Bowling.
Hello, it's Chris Byer.
Hello. All right. We're going to continue our theme on Mental Health Awareness Month, right?
Yes.
So let's talk about costs from a national standpoint, and then let's bring it down into that company level. So about 200 billion a year is what is spent for untreated mental illness. 193 billion of that is for serious mental health treatment. 27 lost workdays. That was a stat
Yep.
that, I mean, let's just call that a month.
Yep.
So you could potentially be losing an employee for 1/12 of that year
Yep.
due to a crisis going on either with themselves, a family member, or extended family as
Yeah.
well. It's
And I would
that's
say when you talk about the 200 billion, that's not medical claim cost. That is
oh
overall somewhat medical costs, but turnover, absenteeism, productivity, it's costing the workforce in that case. Because a lot of this you're not seeing directly tied to what we do with health insurance
right.
claims in that situation. Occasionally there are. I mean, there's serious conditions that will impact claims, but I think it's the overall well-being of that
Yeah.
individual or their family that is being missed.
Yeah, I think out of our clients, we have two uh inpatient mental health stay showed up in the top three of our cost of claims.
Yeah.
It was
Yeah.
really
So you think about that, and especially if you're the CFO of an organization or CEO, even HR. I don't think this is a siloed conversation. You know, if mental health care is not a priority at the company, yes, your employees are not the best version of themselves, or if there's a challenge with their household, they're not thinking about work because they've got somebody struggling at home. But again, you think of what a healthy functioning workforce can be if mental health is made a priority, because we talk so much about the physical side of it.
right.
Make sure we're doing our health screenings, make sure we're getting blood pressure under control, watching our food intake, exercise. But if you're ignoring the mental health aspect, all of that can be in check, and you can have somebody that is just absolutely struggling to get their job done, to live their life. And hopefully this is something that employers are taking notice of.
Yeah, or it's their inability to make that a priority because they're dealing with such a crisis in their life. I mean,
Yeah.
who cares about exercise and diet and everything else when this is taking up 80% of my mental capacity dealing with
Yeah.
something chronic. So yeah,
Yeah.
I think, and you and I have talked about this. I think the day that we can ignore this is gone. I mean, it's got
Yeah.
to be part of that plan design, part of that discussion of, how do we address this? And of course, everything has to fit within a budget, but what's it going to cost if you don't?
Yeah, there's a lot of creative ways to make that a focal point without necessarily increasing cost, and just starting that discussion as part of your wellness initiative, not even a wellness program, but just the focus on wellness has to include mental health,
Yeah.
and being able to speak to that the same way that you speak to your annual wellness visit that you have for your preventative care. So I know we're not really talking so much about solutions this week, but I did have one that was interesting that we had a client ask us to review a program that helps with bereavement.
Yeah.
And this is the first time I had seen this, and it was very inexpensive. But I started to think about that. The same thing, the employer saying, all right, this is an area that is impacting our workforce when they are either dealing with the loss of a child, a spouse, or potentially they're caring for, taking care of somebody who just passed away as an older generation. But how do you help that person deal with the next steps after somebody died? And I was like, that's what we do. All of us have done this in some format. And then I started to really think about that. If you've never written the obituary, if you have never planned the service, if you have never read a will, if you've never gone and spoken to a lawyer, what do you do first? And if you don't have that under control, you're not thinking about work. So it's beyond just helping somebody grieve and counsel them through that. It was that is a piece of it, but also how do we help them do the tactical work to take care of somebody who has passed away? I
Yeah.
was like, this is fantastic. I mean,
Yeah.
it made so much sense to add. And I was really excited to see that there's something like that out there that I never thought of before in terms of an employee benefit, or a way to give somebody a relief of burden.
Yeah, I mean, as you know, it's impacted our life personally. We lost my father suddenly at the age of 60, and if it wasn't for Carrie helping us,
Yeah.
get through that process and understanding what we had to plan and we
Yeah.
were a mess. We couldn't even think.
Yeah.
One day I'm talking to my dad, the next day he's dead. I mean, it's just,
Yeah.
how does a family deal with the things that we have to do when somebody dies?
Yeah.
We were not
Yeah.
we were close to having that capacity to do that. And yeah, to have
And you
that
think of how complex households are too now. You think about that if you're, a
yes,
single parent with several kids and you have to be at work in order to provide, or again, you're a family that's just that busy and has things going on, or you've got two working parents and neither of them have the ability to take time off and go through this, like, it creates a big mess. Just like you said, I mean, you had Carrie's organizational expertise and all those things to help through, but it's still, there's not an easy way to prepare for
yeah,
it. So I was really encouraged to see that. That's just
very
another topic of overall well-being and a way to help people through what would be a very challenging mental health situation.
good point. Great topic again. I think
Absolutely.
whatever we can do to help people get a little bit better, that's what we try to do.
That's the plan. Thanks, CB.
Thanks, buddy. We'll see you.
All right. Bye-bye.